Hello all, how are you today? Welcome back to your own YouTube channel, Ask Your Gynecologist. I am Dr. Sonal Parihar. So today's topic you must have already noted, it is about contraception, the contraceptive devices. Before that, I just want to tell you all that ever since you actually downloaded DocWise app, I told you to download that. So many patients have been connected with me. I'm getting messages daily. It has like made my life easy. It has made your life easy. Now you can directly connect with me. It also has an option of calling. You cannot call, but if I feel like calling you, I can call you through the app. So you can just message me, ma'am, please call. I will call you, definitely call you. And because the application has characters of a WhatsApp, you can send your reports, you can send your prescription. So that has made life very easy. So many patients are connected. So people who have not downloaded, please download it. Otherwise, if you want the hospital's address, that's my address. That's the phone number, the landline number. You can take an appointment if you want to visit me. That is the number, the mobile number. That's the number of my secretary. You can call her, you can fix up an appointment. If you have any query regarding payment, regarding how to download the application, you can always contact her. She's always there to help you out. Okay, so now we start the topic, contraceptive devices. Now friends, contraception is very important in life. Everybody knows that. Contraception is used in two ways. One is, of course, as the name indicates, to avoid unwanted pregnancy, and the second is to avoid and to prevent sexually transmitted diseases, right? Because there are certain contraceptives, only one contraceptive in fact, that is condom, which is a barrier contraceptive, which is very, very effective in protecting you from and preventing you from sexually acquired diseases, right? Now coming to the contraceptive devices, why people are not very frequently using them? Because first of all, they either don't know. That is why I started this channel, so that you can directly come to know about your body, about the devices which are available in the market. Okay. Second reason is maybe just laziness. We don't want to use it. We'll see. If you get pregnant, we'll go to the doctor. Abortion is quite easy. Or the ladies are dependent on their husbands. They don't bring the right things to home. So I think this channel, this video is going to help you, and you will definitely understand what all things are suitable for you. Okay. Another thing, if you don't use contraception, 80% of the ladies will get pregnant, definitely get pregnant. Now why only 80%? Why not 100%? Because 20% ladies are those lucky ones, or you can say the unlucky ones, because some people actually want pregnancy, in which there is some problem going on inside the body. Sometimes the timing doesn't match. The patients, they ask me, ma'am, I am living with my husband almost like he comes every 2 months and we stay together. In a year he comes 2-3 times, and even then he stays for 2 months, we can't get pregnant. That is because that is nature. Now we don't know when you are ovulating, your egg is getting released, you're having intercourse with your partner, the sperm is going inside. What happens inside? There may be a chemical pregnancy, there may not be a pregnancy, they may not meet, the zygote might not form, the fetus might not form. So we don't know. We cannot play with nature. Nobody can answer that, neither me nor you. So that is why we say that when you're having unprotected sex, only 80% of the ladies get pregnant, but 80% also is a very big number. Okay, so for patients, for people who do not want a pregnancy, 80% is a very big number. So you have to use contraceptive devices, right? So today, because as I said, it is a very vast topic. There are almost 14 to 15 methods of contraception available in the market, right? So today we are going to discuss only those methods in which you do not need a doctor. You can do it, you can manage it on your own, right? So first of all, we come to natural method. Now natural method, as the name indicates, it is something which a lady has to regulate. She needs to know when she's ovulating, right? So natural method is when you know your menstrual cycle. Say if you have a 28-day cycle, we know that around 14th day in the middle, there is some ovulation going on, right? So if we actually divide it into 3 parts, this is what I explain to my patients: 10, 10 and 10. So initial 10 days are safe. 10th to 20th day, because we don't know it, the ovulation might happen on the 11th day, 14th day, 16th day, and the ova is there in the body for around 4 days. It is alive, it is waiting for the sperm. So those 10 days are unsafe. Then again the last 10 days before your periods are safe. So that is, like, broadly speaking, 10, 10, 10. If you have a shorter cycle, then I would say the initial 7 days are safe, starting from the first day of your menstrual period till the first 7 days. After that, the unsafe period starts, because shorter cycle means you are ovulating early. Then again, last 7 days are safe, just before your menstrual period. So that is for the shorter cycles. For longer cycles, as I said before, you can just say 10 days in the initially and the 10 days the last ones. In between you might have 20 days, you might have 10 days, you might have 14 days, depending on the length of the cycle. So just make it 10, initial 10 and the last 10 for the girls who are having, ladies who are having longer cycles. So that is a natural method. Another 2 indications which actually indicate you or tell you that you're going to ovulate is your basal body temperature. Generally the temperature of the woman goes up rises up if you're going to ovulate. Within 1 or 2 days before the ovulation, your temperature will go up, but it's very difficult to actually analyze that unless you actually feel it, that yes, my body is feeling warm. Second thing is the cervical mucus. As I discussed in the video of white discharge, why the discharge happens, which is a natural discharge during ovulation, your cervical mucus, the vaginal discharge that you are passing, is very watery. It's like egg yolk. Sorry, not egg yolk, the egg white. The whitish egg-like discharge that you get during ovulation is because your body is preparing. It is inviting pregnancy. Okay, so those 4 or 5 days you know that you're ovulating. So if you actually stick to these methods, then you might be able to like practice them throughout your life. Some people I've seen are very good at it, so 100% results are there. But as I said, it is not very safe. It is not very effective. So there may be a lot of human errors. So this is the natural method. Next, coming to the barrier contraceptives. Now, barrier, as the name indicates, is a barrier between the male and the female. So the best barrier contraceptive so far is condom, and it is widely used. Male condoms are there, female condoms are there. They are very good in protecting you from sexually transmitted diseases because they entirely cover the perineum. The female perineum or the male genital organ, everything is completely covered, so they protect you from sexually transmitted diseases, and or they're almost 98 to 99% effective if they're used properly. But then again, the failure rate has been seen to be 10 to 14% of the ladies, they get pregnant because of minor breakage in the condoms, which you don't realize. Okay, so this is one. If the female is using a condom, then female condoms are not very commonly used, but they are slightly larger than the male condom, and they're slightly more costlier, and they have to be inserted, say maybe just a couple of minutes or couple of hours before the sex and immediately removed after sex, right? So because they cover the entire perineum, they're very good for infections. Second is the diaphragm. Diaphragm is again, it's a like kind of membrane which we insert in the vagina. The lady inserts in the vagina. It has to be inserted at least 6 to 8 hours before sex so that it completely covers and completely fits there. It might be impregnated with some spermicide cream just to make it more effective. As a cream indicates, spermicide means it is cidal, it is destructive to the sperms. It is something which destroys the sperms. So if it is it has a double action. Then if it is a membrane which is already covered with a cream which is killing the sperms, it has a dual action. And after sex you have to remove it within 24 hours because otherwise it will cause infection. Okay, bladder infections have been noted very commonly. So cystitis has been noted very commonly. So diaphragm has to be removed within 24 hours. Clean it properly so that you can use it again. Okay, the third barrier contraceptive can be a cervical cap. Just like a menstrual cup, which we discussed in the menstruation video. Similarly, it is a fem cap. It is known as a fem cap, means a female cap. It covers like a piston. It covers the mouth of the cervix. It has to be inserted around 6 hours before the sexual activity so that it fits in properly. And again, removed not before 6 hours after sex, because for these 6 hours, the sperms which are there in the vagina, they will take time to die or come out or wash out, right? So if you remove it before 6 hours, there might be some sperms which can enter inside the cervical canal and reach your uterus, and you can get pregnant. Okay, again this cap might be impregnated with the spermicidal cream. Again, it is not very effective. Diaphragm and cervical cap, again, as I said, they are not very effective when it comes to sexually transmitted diseases because they are not covering the entire perineum. There is some contact between the fluid and the vagina, right? So they are not very good in preventing the infections. Next comes sponge. Sponge is just like a normal sponge. It's a small block which you can insert inside, say around 6 hours before sexual activity, so that it swells and stays there. It might be impregnated with the cream, which I said, which is easily available in the market, and so it has a double action, and it has to be removed after 6 hours, as I said, in the cervical cap, because there might be some sperms and semen left in the vagina which might cause a pregnancy. So you have to remove it not before 6 hours, but please remove it after 6 hours because it can lead to toxic shock syndrome, which is a very fatal condition. It is a shock syndrome which is caused because of infection, and we discussed this in case of tampons as well. Some people forget to remove tampons. Similarly, people forget to remove diaphragms. They forget to remove sponges. So please be careful with your body. Okay. Then the last barrier contraceptive can be a spermicidal cream. Spermicidal cream is just like a vaginal cream. You apply it inside. You can use an applicator. You can use your finger. Again, it will not be distributed very evenly, so obviously we cannot check the efficacy. It will not be obviously very effective as compared to condoms. So again, this is an option for an emergency thing. When you don't have anything, you just have the cream, you can use it. Okay. Next, coming to the third category, that is the emergency contraception. The emergency contraception, as the name indicates, it's an emergency. Please do not use it as a regular contraceptive. I have seen many couples doing this. Many couples, they come to me that, ma'am, I regularly use I-pill. Well, it is not to be used regularly. It is an emergency thing when you think that your condom had like ruptured inside, or you feel that you know that you have missed a couple of pills and you had an unprotected sex today and you are worried that I might get pregnant. Or if it's an unwanted pregnancy, in the case of like teenage pregnancy, or unmarried people having sex intercourse. So as the name indicates, it has to be used only in an emergency, because it can cause a lot of hormonal problems inside you. I have already made a small video. If you check my channel, from in the initial few videos when I just started the channel, I have uploaded a short video, 1.5 minutes, in which I have told that please do not use it as a natural, a normal daily routine contraceptive device. Okay, so there are two ways in which you can prevent emergency pregnancy. That is, emergency contraception can be in the form of a tablet, which is a high dose progesterone. It is normally 150 milligrams. Initially we used to give you 2 tablets of 75, that is 75 plus 75 makes it 150, but now there is one single tablet of 150. Now it's a high dose tablet, so you might vomit as well. So just be careful. If you vomit within 3 hours, it takes around 3 hours to get into action. So if you vomit in 3 hours, that means it has not gone inside your body, it has not dissolved, not started its action, so you have to take it again. Okay, and this tablet, if it has to be used properly, it should be taken within 3 hours, within 3 days of unprotected sex. That is 72 hours within after you had your unprotected sex, right? Now, why do we say 3 days? Because it is most effective at that time. Although the books, they would say that you can take it for 5 days, but 3 days is very effective. But again, it has a failure of 3%, so only 97% protection it gives you against pregnancy. So there are still failures, and you have to wait for your period. Do not be like very happy, okay, I've taken the emergency contraception, now I don't need to worry. You have to worry unless you get your periods. Okay, the second way, in case you cannot get access to the tablet, or you did not take it, or you vomited it, whatever, the other way is inserting an IUCD. That's a copper T, right, or a multi-load. So if you go to your doctor, it gives you 5 days. Within 5 days, if you get this inserted, because it takes the pregnancy to come to the uterus to about 5 days, because we discussed it initially also in some videos, that the egg and the sperm, they meet, they form a zygote that comes into the fallopian tube, and then it takes around 2-3 days, 4 days to come to the uterus. So the total procedure will take 5 days. So if you get a copper T, an IUCD inserted inside the uterus, it will prevent that impregnation of pregnancy. Okay, so that is another method. Again, it's not foolproof. You have to wait for your period, right? And if you get pregnant, then obviously you have to go to your doctor. So guys, this is all for today. We have discussed all the methods in which you do not need a doctor. Everything is available in the market, so you can always, you have a big buffet for you, so you can always choose from there. Okay, so till then, please follow me on my channel, and you can always inbox me. I have started going live for the last couple of days. I'm trying to go live every day and answering 10 to 12 questions for 10 minutes. I'm live, so really, like, I love connecting with you. As soon as I go live, there are so many people watching me, and if I'm not able to answer your question in writing, I will definitely go live and answer that in the video. So please watch my videos, watch all my videos and share them, so that even other people can get benefit. Okay, and please do subscribe to my channel, tell your friends, tell your family, because it is your channel for your own benefit. You can follow me on my Instagram handle, my Facebook pages, and please do download the app DocWise, and it will really help you. So till then, take care, bye bye.